Do you think you are forgetting things very frequently nowadays? And are you concerned that you might be having dementia? So what is dementia? Let us have a look into the signs and symptoms and what we might do to prevent it. So dementia is a neurodegenerative disorder where either the neurons or the connections between the neurons are disrupted. What might be the symptoms? Yes, there is forgetfulness. That is, people usually forget the recent things, that is, what they have done in the last few days, or whatever messages have been given to them, or maybe where they have kept their own things. Very interestingly, the older memories or the remote memories or the long-term memories that we speak of, they are preserved. Other than forgetfulness, there may be also disturbances in other areas of intellectual functioning. Like the person might have language disturbances. That is, he might have difficulty in naming things or expressing himself properly or understanding commands or understanding instructions. There may be difficulties in finding his way out in the house or in other places. So there may be people who are actually losing their ways in the streets when they are developing dementias. There may be problems in planning out things. A person who was very organized in household work or in his office work may find it difficult to do the different steps of the activities properly. Often we speak of the ABC of dementia. That is, A, activities of daily living are hampered. The person might find it difficult to eat, to take care of himself, to take bath, to do his toileting activities by himself. Then there might be behavioral changes or what we call as personality changes. Someone who was very polite and organized before might seem very different. In fact, people come and say that that my father is such a changed person now. He might be unsocial or he might start making inappropriate jokes or may not be taking as good care of himself as he was before. And of course, the C is the cognitive abilities or the intellectual abilities. That is the differences in language, in memory, in topographical orientation, in executive functions or in planning and organization of his activities, as I was already saying before. Now, who are the ones who might develop dementia? Yes, it is a disorder. It's an illness of the old age. As our age increases, our risk of developing dementias increase. Other than age, risk factors of dementia include head injury in the past, having a family history of dementia, having diabetes, hypertension, or strokes. So is there any way that we might prevent oneself from developing dementia? Yes. The more you use your brain, the better it will be. Use it or lose it. That is the rule of the neurons. It has been seen that people like professors with the same amount of brain loss would have less symptoms compared to somebody who has not studied for such a long time. It has also been seen that socialization, interacting with your friends and families, may help to prevent cognitive disturbances. It has been seen that aerobic exercises also help to develop the memory cells. That is, the more you are active, maybe elderly people going for running or for swimming or exercising regularly, would be having a less chance of developing memory disturbances. So what do we do if you know of somebody, especially an elderly person at home who is having such symptoms? In our clinics, we find people being brought at very late stages. Most of the time, the family members think that these symptoms are a part of normal aging. But mind it, dementia is a disorder of old age. So what do we do? What should we do? please bring your patient, please bring that individual for a proper assessment to a clinic. Either a neurologist or a psychiatrist would be seeing these patients. In certain cases, psychologists might be also seeing the patient. We do a clinical workup, or we take the history, the details of the behavioral changes, and then we might advise certain blood tests, certain imaging studies of the brain, and we might also go for certain paper and pencil tests, what we call as neuropsychological tests. And now what about the treatment? Dementia really has no treatment, but that doesn't mean that we need to be hopeless about your patient. There are a lot of things which can be done. There are certain medications which can slow down the progress of the disease. Medicines are available for treating the behavioral problems like emotional disorders, aggression, sleep disturbances, appetite disturbances. There are different types of dementias like frontotemporal dementia, stroke-related dementias, or those with Parkinson's disease, HIV, head injury. But Alzheimer's disease is the commonest type of dementia, and 21st September is observed as World Alzheimer's Day so that we may spread awareness about this particular disease, and so that people may become aware and bring the individuals for proper treatment and for proper assessment at the earliest.